Well, all headaches are not created equal, and in this week's Here's to Health segment, we're talking about why it's important to know how headaches can vary. And we've got Dr. Kendra Pearson from Integrated Physical Medicine of Kansas City. She's here with us this morning. Now, not all headaches are migraines, and not all headaches are created equal. So what are some of the symptoms of a tension or a stress headache?
Well, they can be similar to migraines, but they are different. That's why it's important to kind of really get a good symptom history with our patients and find out what they're suffering from. So migraines can be like very focal pain, like behind the eye and the top of the head.
Searing, blinding, yeah.
Tension headaches typically start at the base of the neck or the base of the skull.
Hello, that would be me, yes.
So stress, life stressors, injuries in life that cause injuries to muscles can cause the muscles to tighten up and the shoulders end up here, and you're like, why are my shoulders here? And you try to push them down. And then it causes the muscles to spasm. Pain can move up to the head and form a tight band around the head. Then it starts to feel like a migraine. So there's kind of a gray area there. So that's why it's important to really understand what the patient's feeling.
I kind of have a hybrid of all three of those at one point or another. So
most people do.
Yeah. All right. So when it comes to headache pain, what can people expect when they come to see you during their first appointment?
Well, if you're looking for more of a solution and not just covering up pain, for your entire life, what we really need to do is you need to sit down and talk with the patients. Our doctors are going to get a very good symptom history. Just by talking to a patient, myself and the other doctors in our office, we can find out, almost what's really causing their headache.
You have to get to the root of the problem.
Yes. Then we really need to do a very hands-on physical exam, an intense physical exam, feeling the muscles, testing nerves, an orthopedic exam, testing that, because we need to know, is it a true migraine or is it a tension headache? Because if I'm just prescribing medication and just covering up the pain, but it's muscle spasm in the neck that's causing it, we want to offer solutions. We want to get to the bottom of the problem. So we really need to focus on our patients and not just, really quick write that script.
Now, what do you treat more of? Do you see more migraines or more tension headaches?
We really see both. They're the two most common types of headaches, and really there's that gray area. Most patients have both. Migraines are one of those types of headaches that have triggers. Foods trigger it, smells trigger it, lights trigger it. Tension headaches trigger migraines. So a lot of people who have tension headaches
so it goes.
End up with migraines. So our treatment in our office tends to be treating both, because we don't want to treat one without treating the other.
Now, when you do treat people who suffer from tension headaches, what remedies are there?
Well, in our office, we like to get patients off of these medications that have side effects. We have a brand new FDA-approved treatment in our office. It's a nerve block for headaches. It's extremely simple. Our patients love. We have a 90% success rate. We're getting people off of meds. But if we can block that pain, then we can also treat the underlying condition, whether it is a pinched nerve or muscle spasm or those tension-type headaches. Then, you're cured, and that's what we want.
I want to know, does headache treatment hurt?
No, well, the treatment in our office does not. Nerve block, people can be kind of nervous about that. It's not a needle. It's actually a very simple treatment. Maybe just patients just feel like it's a tickle. But, just amazing results. Our patients are so happy. I see these patients come in our office and they're grumpy and they're mean and they're upset with their life because they're in so much pain. And then all of a sudden they come in and their hair looks great and their clothes look great and they're feeling good and they're smiling. And it's because they're better, and I just love it.
They're the new Jan Brady, thanks to you. That's awesome. All right, well, we appreciate it. All right, well,